Good afternoon, everybody. My name is Quincy Robinson, and today, on the lovely July 29, 2015, I'll be informing you about the candidiasis trio. Now today, there will be many checkpoints during my presentation. I'll go over the definitions, the causes, the diagnostic methods, the treatments, the preventions. I will go through an experiment, do my conclusion, show you all my citations, and then open the floor to any questions that you guys may have. I'm sorry. Definition. What is candidiasis? Candidiasis is the overgrowth of a yeast-like fungi called Candida albicans. Now there are many more other yeast-like fungi, but this is the most prevalent one. This infection is gram-positive. Now there are three main types of candidiasis: vaginal candidiasis, oral thrush, and finally the candidiasis of the skin. I'll be giving you an overview of all of these today. Causes. All of these infections can be caused by diabetes. All three infections can be caused by diabetes because of the sugar. The sugar helps the Candida albicans grow in the body. A vaginal yeast infection can be caused by antibiotic use and douching. Now I want you all to imagine my hands as a balanced scale and the vagina. Now, as you know, when you take antibiotics, you kill good and bad bacteria. So, as you take the antibiotics, the amount of bacteria goes down, allowing the amount of yeast to go up, causing an unbalanced mix. This causes the yeast infection. Now, of course, the goal is to get this back down to a level amount. I'll show you how to do that later in the treatments. And then another way to get a vaginal yeast infection is by douching. Now, I know most of you don't know what douching is. Douching is when a woman squirts a mix of water and vinegar up their vagina. They mostly do this after the menstrual cycle because they feel as if this will make them clean. When in all actuality, this is actually hurting them because doctors, of course, one, you can get this disease, and two, because if a pregnant woman does this, it can cause things such as birth defects in her child and a premature baby. Next, oral thrush. Oral thrush can be caused by a vaginal yeast infection and, as I said before, diabetes. Vaginal yeast infection can cause oral thrush because if a pregnant mother has a vaginal yeast infection, she can expose her baby to the Candida albicans during delivery, then giving the baby oral thrush. Lastly, candidiasis of the skin can be caused by, as I said before, diabetes and warm, moist areas such as the armpits and groin. It can be caused in these areas because Candida albicans grows in warm, moist areas. Okay. Some symptoms of vaginal candidiasis include a burning sensation when urinating, a burning sensation during intercourse, pain during sex, soreness, an odor-free white discharge, and it can also cause burning, redness, and swelling of the vagina and vulva. Next, oral thrush. Oral thrush can cause white lesions in the mouth and sometimes in the throat and the gums and tonsils. The lesions are the damaged tissue due to the overgrowth of the Candida albicans. This infection can also cause the cracking around the lips, loss of taste, and difficulty when swallowing. Lastly, candidiasis of the skin can cause things such as the peeling of the skin, rashes, irritation, blisters, and finally pustules. Pustules are pimples on the skin full of pus. Diagnostic methods. For vaginal candidiasis, there are two main ways to diagnose it. One, with a pelvic exam. This is when they look for discharge and swelling in the vagina. The next method that they use is they take the discharge and take it to a lab and look at it under a microscope. They then look for the overgrowth of the Candida albicans. Next, oral thrush. The main way of diagnosing oral thrush is by doing an endoscopic exam. This is when they put a tube down your throat with a camera and a light and look for some of the symptoms such as the white lesions and yeah. Lastly, for candidiasis, the two ways they diagnose this is by simply looking at the skin, and two, testing for diabetes. Because if you have diabetes, you're more prone to getting infection in the skin. Some treatments that you take if you have this infection are antifungal medications, and this can be in the form of a liquid or a pill, and even cough drops. The second way you can treat this infection is by using suppositories. So when you take suppositories, they dissolve in the blood, help you fight off this infection. And lastly, you can use over-the-counter drugs. These 5 drugs listed won an Editor's Choice Award because of the natural ingredients they use to help treat this infection. Now, some preventions if you don't want to get this disease, of course that must be all of you, by not douching because the harmful effects of douching. Avoid sensitive feminine products because it can irritate the vagina. Excuse me. Avoid wearing tight bottoms because Candida albicans likes to grow in more moist areas. Change out of swimsuits and workout clothing immediately because of what I just said. And if you have diabetes, control your blood sugar because you'll be less prone to the disease. Now for my experiment. My experiment was done by the lovely Jen Abbott, and it is titled Clinical and Microscopic Diagnosis of a Vaginal Yeast Infection, a Prospective Analysis. Now the objective was to see if the way medical professionals diagnosed a vaginal yeast infection were accurate or not. Jen didn't really have a hypothesis, but she believed that this study would help accurately diagnose a vaginal yeast infection. Now the materials in which she did this with are 71 women from the ages 16 to 59 with complaints of discomfort due to itching and discharge. Now before they did this experiment, all 71 women were diagnosed with a vaginal yeast infection at this clinic because of their symptoms and complaints. Now what Jen did that was different from what the doctors did, instead of looking at the symptoms, she actually took swabs of the discharge from all 71 women and put it under a microscope. Shockingly, after this experiment, out of all 71 women that were depicted positive for a vaginal yeast infection, only 32 of them actually had a yeast infection. This means that about 55% of them were misdiagnosed, leading Abbott to feel as if that the criteria for having a vaginal yeast infection are just thoughtless, and she also feels that maybe if the clinic did follow-ups and checkups on the women that they could have found out what was actually wrong with the others that were misdiagnosed. In conclusion, although this disease is not fatal, it can cause many effective things to anyone from a baby to an old grandma. Now, I would like to end you all off with my saying, in order for all of us to be healthy beasts, we must avoid this unwanted yeast. These are my citations, and I would like to thank you for your time. It was an honor being up here presenting to you guys. And now I'll open the floor to any questions that you may have. Okay. Zuri? Zuri wants to know if there's any other ways to contract oral thrush. Yes, there is. If the baby has oral Oh, excuse me, no, I'm sorry. You can contract oral thrush by having oral sex, because if someone has a vaginal yeast infection of the vagina, or you can contract it by having oral sex with them. Does that answer your question? Alexa.
How many cases are recorded a year for like the different types of infections?
Alexa would like to know how many cases are recorded each year for the infections. I will tell you all for all three. For candidiasis of the skin, there are 200,000 to 3 million cases per year. For oral thrush, there are 3 million plus cases per year. And finally, for a vaginal yeast infection, there are over 3 million cases recorded per year. Does this answer your question?
It really does. Yeah.
Chris.
Okay, so I'm not exactly sure if you stated this in your presentation, but what are some of the ways, if they can, how guys can get Candida albicus?
Can you rephrase your question? I can't really understand what you're saying.
Okay, so is it possible for males to get Candida albicus?
Candida albicans is the yeast-like fungi that causes the infection, and yes, it is possible. Do you want to know how?
Yes.
It's the same way for women as it is for men. You can contract it. You can contract it by taking antibiotics. Yeah, that's like the main thing, and having diabetes also too. Does that answer your question?
Yes.
Okay, one more.
Emily?
I know. Okay, so if the baby had oral thrush and they were breastfeeding, does the mom get it too?
Okay. Emily would like to know if the baby has oral thrush and the mom is breastfeeding, what will happen to the mother? Shockingly, the mother does get oral thrush. She actually gets it in the nipples. And some symptoms of getting a yeast infection she gets a yeast infection in the nipples. And some symptoms of that are obviously sore nipples. Does that answer your question?
Yeah. That's the answer, Quincy.
Wow.